This is the audio lecture for Maternal and Fetal Nutrition, Chapter 12. Pregnancy is one of the most nutritionally demanding periods of a woman's life. Gestation involves rapid cell division and organ development, and an adequate supply of nutrients is essential to support this tremendous fetal growth. Nutrition is a significant and alterable factor that influences the outcome of pregnancy. Good nutrition before and during pregnancy is an important preventative measure. We know that good nutrition before and during pregnancy helps protect against low birth weight babies and preterm infants. The first trimester is crucial for embryonic and fetal organ development. A healthful diet is the best way to ensure that adequate nutrients are available for the developing fetus. Folate or folic acid intake is of particular concern. Neural tube defects or failures in closure of the neural tube defect most likely result from a lack of folic acid. Maternal and fetal risk in pregnancy are increased when the mother is significantly under or overweight. These two pictures give an example of what a neural tube defect looks like in a newborn. Nutrient needs during pregnancy. They are determined in part by the stage of gestation. First trimester needs are only slightly greater than those before pregnancy. The need for some nutrients increases greatly as fetal growth progresses during the second and third trimester. So some examples of increases that need to be made in the diet. Protein should be increased from 60 to 80 grams a day. Iron should be increased from 18 to 27 grams a day. Folic acid should be increased from 400 to 800 micrograms a day, along with an increase of 300 calories a day over the recommended intake of 18 to 2200 calories for a non-pregnant woman. Weight gain. The amount of weight that a woman gains during pregnancy is not as important as what she eats. A woman can lose extra weight after a pregnancy, but she can never make up for a poor nutritional status during the pregnancy. The optimal weight gain during pregnancy is not known precisely. Desirable weight gains varies among women. Maternal weight gain has an important bearing on the course and outcome of the pregnancy. We know that adequate weight gain is associated with a reduced risk of giving birth to a small for gestational age baby, or a low birth weight baby, or a preterm baby also. Adequate weight gain does not necessarily indicate a nutritionally adequate diet. We need to enforce to our moms that it does matter the types of foods they eat. So a mom who's getting the extra 300 calories by going to McDonald's versus a mom who's getting the extra 300 calories by eating maybe an apple or an orange or some type of vegetables, it varies greatly. So we need to ensure that our moms are adding these extra calories with healthy alternatives. The primary factor to consider is the appropriateness of pre-pregnancy weight. Normal weight and underweight women with inadequate weight gain have an increased risk of giving birth to an infant with intrauterine growth restriction, or IUGR. Conversely, if a woman is obese, whether it's pre-existing or new, it causes increased likelihood of birth complications, emergency cesarean birth, postpartum hemorrhage, wound, genital tract or urinary tract infection, birth trauma, and late fetal death. Most likely this is because the obese woman has gestational diabetes, and typically our women who are gestational diabetics tend to have babies that we term macrosomic. They have really big babies. So having these big babies can lead to all of the complications that were stated earlier. In maternity, we commonly use the body mass index as a method of evaluating the appropriateness of weight gain for height. Current recommendations that you'll see: women with normal BMIs should gain, I usually use the pounds, most people understand pounds, but I also have the kilos listed. A normal weight woman or a normal BMI should gain 25 to 35 pounds. Underweight women should gain between 27.5 to 28 to 40 pounds. Overweight women should gain 15 to 25 pounds. Obese with a BMI greater than or equal to 30, the total weight gain should range between 11 to 20 pounds. My adolescents, wherever they fall in the BMI spectrum, they should aim for the upper end. Why is that? Because at this age they are still laying down the foundation of their bodies, so they need extra nutrients, extra vitamins to help aid with their growth also. So weight gain again: normal weight 25 to 35 pounds. Underweight, some books say reach the ideal BMI, then add the 25 to 35 pounds. Either way, if they gain the 27.5 to 40 pounds, I would take both answers. Just different books differ, so I put both charts. Overweight 15 to 25 pounds, obese less than 15 pounds. Now, the rate at which a woman gains weight also differs per trimester. So the pattern of weight gain typically in the first trimester is 3.5 to 5 pounds, and then the second and third trimester they should gain between 12 to 15 pounds each trimester. Now notice this is for a woman who is normal weight. My women who are overweight and are obese, they should gain less, and my women who are underweight should gain a little bit more. Just to drive the point home, patterns of weight gain: poor weight gain early in pregnancy increases the risk of giving birth to an SGA, a small for gestational age infant, or an LBW, a low birth weight infant. Poor weight gain late in pregnancy increases the risk of preterm birth, preterm delivery. The optimal rate of weight gain depends on the stage of pregnancy. We know that in the first and second trimesters, weight gain takes place primarily in the maternal tissues. And then in the third trimester, growth occurs primarily in the fetal tissues. So those maternal tissues, the uterus, the extra blood flow, the breast tissue. First trimester weight gain is only 1 to 2.5 kilos. And then we need to make sure that the mom is taking 300 calories a day over her pre-pregnancy intake, and that is recommended for the second and third trimesters when growth of the maternal tissue and fetal tissue really starts to expand. So tissues contributing to weight gain. This is just a fun little slide I like to put up because it shows you where all of the weight that a woman gains goes. So at 40 weeks of gestation, increased maternal fat stores account for 4 to 6 pounds. Increased tissue fluid, 3 to 5 pounds. Increased blood volume, 4 to 5 pounds. Breast tissue, 1 to 4 pounds. Increase in uterine tissue, 2 pounds. Amniotic fluid accounts for 2 pounds. The placenta, 2 to 2.5 pounds. And then the baby or the fetus, 7 to 8.5 pounds. So I like to encourage the mothers that after you give birth, that's almost an automatic between the amniotic fluid, the placenta, and the fetus. That's a 10-pound weight loss in no time. All right, necessary nutrients during pregnancy. Vitamin supplementation. Typically, there's only 3 vitamins that we put most pregnant women on. The first is a prenatal vitamin. Every pregnant woman or woman who is trying to conceive should be on a prenatal vitamin. Iron And then all the things that we learn when we take iron, we have to teach our women. Take it with OJ to increase absorption. It can cause GI upset, constipation, the black tarry stools, all of that stuff you learned in farm should come into play. Typically with iron, a lot of women have problems with iron ingestion. So one of my little tips that I give my moms is if they're on iron, take it right before they go to bed. That way they can sleep through all the uncomfortable GI upset that it may cause. Folic acid, 400 micrograms a day. We know that folic acid decreases the risk of infant developing neural tube defects. And as a nurse, we have to be able to teach moms the foods that are rich in folate, such as the green leafy vegetables, liver, peanuts, and fortified whole grain breads and cereals. Like I said, if a pregnant woman's diet is adequate, the only vitamin supplementation she would need during pregnancy are her prenatal vitamins, her iron, and folic acid. Vegans. Vegetarian diets are becoming increasingly prevalent in the United States. People choose a vegetarian diet for various reasons, including environmental, animal rights, philosophical, religious, and health beliefs. Vegetarians choose not to eat meat, poultry, and fish. Their diets consist mostly of plant-based foods such as legumes, vegetables, whole grains, nuts, and seeds. Vegetarians fall into groups defined by the types of foods they eat. Lacto-ovo vegetarians omit red meat, fish, and poultry, but eat eggs, milk, and dairy products in addition to the plant-based foods. Lacto-vegetarians consume milk and dairy products along with plant-based foods. They omit eggs, meat, fish, and poultry. Vegans eliminate all foods from animals, including milk, eggs, cheese, and eat only plant-based foods. The concern with any form of vegetarianism, especially during pregnancy, is that the diet may be inadequate in nutrients. Other risks of vegetarian eating patterns during pregnancy may include low gestational weight gain, iron deficiency anemia, compromised protein utilization, and decreased mineral absorption. As nurses, we can teach pregnant vegetarians to pay special attention to their intake of protein, iron, calcium, and vitamin B12. So for protein, we can offer substitute soy foods, beans, lentils, nuts, grains, and seeds. For iron, they can eat a variety of meat alternatives along with vitamin C rich foods. For calcium, they can substitute soy, calcium fortified orange juice, and tofu. And for vitamin B12, they can eat fortified soy foods and a B12 supplement. Your vegans, it's also very important to do careful diet assessments, and we may have to use several forms of vitamin supplementation depending on how strict of a vegan the person is. And typically sending your vegetarians to a nutritionist would be ideal so that they can really go through their diets and make sure that they add the necessary nutrients appropriate for a healthy pregnancy. Fluids during pregnancy. They are essential for the exchange of nutrients and waste products across the cell membrane. They promote good bowel function. Typically, especially here in Florida, I tell my moms, especially in the summer when it's hot, 10 to 12 glasses of fluid per day. Your book says 6 to 8, but like I say in Florida in the summertime, I usually tell them 10 to 12, especially if they are out in the sun a lot. Water, milk, and juices are good fluid sources. The reason why we want our moms to stay well hydrated is because dehydration may increase the risk of cramping, contractions, and preterm labor. So it's very important that my women stay hydrated while they're pregnant, especially during the hot Florida summers. Pica and food cravings. Many women experience unusual food cravings during their pregnancy. Having cravings during pregnancy is perfectly normal. Sometimes, however, women crave substances that have no nutritional value and can even be dangerous to themselves and their fetus. Pica is the compulsive ingestion of non-food substances such as clay, dirt, and laundry starch. We know pica is often influenced by one's cultural background, is most commonly seen among African American women, women from rural areas, and women with a family history of pica. It may cause more nutritious foods to be displaced from the diet. The exact cause of pica is not known. Many theories have been advanced to explain it, but none has been proven scientifically. The incidence of pica is difficult to determine since it is underreported. Like I said, it is more common in the United States among African American women compared to other ethnicities. But the practice of pica is not limited to any one geographic area, race, creed, or culture. In the United States, pica is also common in women from rural areas and women with a family history. The three main substances consumed by women with pica are soil or clay, ice, and laundry starch. Pica should be considered when a pregnant woman is anemic. A hypothesis for pica is that pica and food cravings during pregnancy are caused by an innate drive to consume nutrients missing from the diet. Typically, our women with pica, we see that their hemoglobin levels are typically lower, and many think that pica is caused by this drop in hemoglobin, or that many women that are anemic may have certain picas. These were some cute pictures that I found on the internet. Some of the picas that I have seen in my work experience, definitely ice. I would have women bring their little coolers to the hospital and beg me to fill it with ice. The laundry starch I see a lot. Soap, I've had women with soap picas. The clay and the dirt picas. I've also had women with paper. I remember having two women in the hospital in the triage area discussing which grocery stores brown paper bags tasted the best. Adolescent pregnancy needs. Many adolescent females have diets that provide less than the recommended intake of key nutrients. Pregnant adolescents and their infants are at increased risk of complications during pregnancy and labor. Growth of the pelvis is delayed in comparison to the stature. There's competition between the growing adolescent and fetus for nutrients. These girls are still growing. That baby's going to take what it needs to grow, and it's going to leave the adolescent mom lacking the nutrients needed for her growth. Pregnant adolescents are encouraged to choose a weight gain goal at the upper end of their BMI range, and research has shown that adolescent pregnancy increases the woman's risk of obesity later in life. Exercise during pregnancy. Moderate exercise during pregnancy yields numerous benefits. It improves muscle tone, it potentially shortens the course of labor, and promotes a sense of well-being. Recommendations for exercise: 30 minutes of moderate physical activity on most, if not all, days of the week, unless contraindicated. So my mom, who is on bed rest, I don't want her outside jogging and power walking. She should be home in the bed. A liberal amount of fluid should be consumed before, during, and after exercises. Remember, I don't want the mom to become dehydrated, because dehydration in pregnancy leads to cramping and contracting and could possibly cause preterm labor and preterm delivery. The caloric intake should be sufficient to meet the needs of pregnancy and the demands of exercise. So some of the exercise that we recommend for pregnant women: I don't want her out there playing tackle football. Low impact aerobics, swimming, walking, things like that are really good exercises that my pregnant mom could include in her daily activities. Key points: women's nutritional status before, during, and after pregnancy contributes to her well being and that of her infant. Physiological changes during pregnancy influence need for additional nutrients and efficiency with which body uses them. A total maternal weight gain and pattern of weight gain are important determinants of the outcome of pregnancy. The appropriateness of mother's pre-pregnancy weight for height, or her BMI, is a major determinant of recommended weight gain during pregnancy. And nutritional risk factors include adolescent pregnancy, bizarre or faddish food habits such as pica, abuse of nicotine, alcohol, or drugs, low weight for height, and frequent pregnancies. Iron supplementation is recommended routinely during pregnancy. Typically, we see the need for iron supplementation during the second trimester when the maternal blood volume starts to increase. Other supplements recommended when nutritional risk factors are present. Like I said, routinely, the only supplements that we use are prenatal vitamins, iron, and folic acid. And the folic acid is to reduce the risk of what? Neural tube defects. The nursing woman influenced by culture and personal values and belief through nutrition counseling. So it's very important that we take into consideration the culture of the woman and make sure that the foods that she's ingesting are going to be nutritionally sound to help with the outcome of her pregnancy. Dietary adaptations can be effective interventions for some common discomforts of pregnancy, including nausea and vomiting, constipation, and heartburn. And we'll talk about that, I think, on Wednesday when I do that lecture. This concludes the lecture for Chapter 12, Maternal and Fetal Nutrition. Thank you.